Hey guys, this is a COMSAE level 3 question with a quick explanation. I just finished taking level 3 and I want to share with you some of the facts you need to know without wasting your time. So let's start. A 40-year-old woman presents to the office with the concern of palpitations that occur in the middle of the night. The most appropriate diagnostic test is, take a second, make your choice. Okay, choice A, Holter monitor, correct answer. This I consider is an easy question, but I'll try to add a few things that can be tested. The Holter monitor, it's for continuous heart rate rhythm recording. It's important to know this is for generally 24 to 48 hours of capture. It can be used up to 7 days. Sometimes the terminology swaps when you're talking about longer periods of time. Cardiac event recorder would be up to 30 days. And then even longer, there's an implantable device called an implantable loop recorder for very rare types of syncope or cryptogenic stroke. But Holter monitor is the thing that you'll see most frequently. And in general, there are two key indications that you need to focus on for board prep. The first, it's appropriate for evaluating unexplained symptoms. So the most classic presentation is just as it presents in this vignette, palpitations. It would also be, Holter monitor would also be appropriate to answer when a patient has unexplained syncope or near syncope events. The second indication when Holter monitor is the correct answer is detection of intermittent arrhythmias. More or less, these things will present the same way: palpitations, unexplained syncope. Holter monitors are used to diagnose paroxysmal AFib, atrial flutter, PVCs, sick sinus syndrome, transient AV block, especially second degree type 2, which definitionally is paroxysmal. Remember, paroxysmal means occurring suddenly, intense bursts, episodic. So second degree type 2 can progress to type 3. Holter monitor is the next best step. That's what you should pick. So the other answer choices, I think it's smart to go through your practice questions and try to treat them like CDM cases, especially easy questions like this, because there is utility. So let's look at these. Choice B, serum glucose levels. It's important to note, if you're given a CDM question with a lot of checkboxes, serum glucose level would absolutely be appropriate to check. Palpitations are a symptom of hypoglycemia, and especially when you have a patient with symptoms at night, which is when patients with diabetes on insulin tend to have hypoglycemia, it would be very appropriate to screen this. It's a metabolic screen, not the right answer in this case. Likewise, choice C, palpitations can be associated with hypercalcemia. What's associated with hypercalcemia? Hyperparathyroidism. So that would be another checkbox. Choice D, signal average ECG. I don't know what that is. I've never seen it on a test. Never seen it as the right answer. It's always incorrect. Don't pick weird things on test day. So if anybody knows, drop me a line or drop a comment. And then choice E, transesophageal echo. It's important to remember that the TEE is the gold standard test for detecting atrial thrombus in people with AFib, not transthoracic echo. Transthoracic echo is generally the first echo that you perform, and that's for valve abnormalities, structural disease, but it's a testable distinction to know that TEE is the gold standard for the thrombus. And that's it. Thanks for watching. Good luck studying.